Hello, good evening, and welcome to Innovative Dentistry. This has become a part of your life. It's one of your favorite shows, and every Wednesday night we come to you into your homes and wherever you are to bring you some really good information on oral health and oral hygiene. As often as we can do this, and if we can increase it and come to you more than once a week, we'll do that. But for now, I'm sure that you will enjoy everything that we have to say. Over the last few months, we've been covering a number of topics, and tonight we'll be doing some recap, and we will be taking questions from the public. So if you have questions, send them in to us, and we will be glad to answer those questions. Dr. Pico is here as always, and he's the man who will be dealing with all of this, and um, he's the expert in everything here tonight. So whatever questions you have tonight, you can send them in via Facebook, and we will be able to answer those questions, because there are, I rather doubt that there is anything that we have covered that Dr. Pico will not be willing to talk about. Dr. Pico, welcome to the show again tonight. How are you doing?
Thank you so much. Very well. What about you?
Very well, thanks too. As I usually ask you, how has been your week, man?
So far, so good. So far, so good.
Brilliant. How are things on the office?
The office is catching up.
Catching up. I like
Yeah,
that. I like that. Which I always appeal to our viewers to WhatsApp, call you, or go down to the office and visit. And if you're joining us for the first time, or if you're joining us as usual, this program is coming to you live from TBN Studios right here in Georgetown, at 126 Little Street, Queenstown. And we are coming to you live on the Guyanese Critic platform, on YouTube, and on Daybreak News. This program is made possible again by Innovative Dental Clinic, and they are located on the railway embankment, 3 buildings off the UG Road, if you're going towards UG or Mahika. So you can go there and you can just pop in, or you can make an appointment. But the numbers are running at the bottom of the screen. Be sure to call Dr. Pico. So Doc, we've been doing this for a while now. We've covered a number of topics. I remember the first program we did, we spoke about, I'd asked the question, when does oral health and oral hygiene begin? And you had said that it starts from the moment a baby is born, because they're going to start crying, they're going to start, so the mouth is there, and they're going to be breastfeeding and all. It's, you need to take care of that. One of the things that stuck with me is that I remember the first program that we did, when you said that a big mistake that people make is that they love to kiss newborn babies on their mouth and so on. And I remember this guy who called me the next day. He said, "Man, you wouldn't believe what I just do." And I got me little baby. I was going to kiss up this baby, put him out, and he said he stopped immediately. And as I said, a lot of times people go, they go out, especially uncle gone out or daddy gone out. He take a few drinks, eat all kind of thing, and he come home and he hasn't cleansed his mouth, and he's emotional because he's he take a few drinks. Like we've been there a couple of times. You get emotional, and then you start kissing up the baby, and then obviously it's not the right thing to do. And that is profound, because it tells a story of where it all begins. And over the weeks we've come and the months we've covered a number of topics where we start talking about where we reach the implants. So it really has been informative. A lot of people has been reaching out to me, and we are gonna be tonight. People are gonna be reaching out to us, so we can have some little breaks in between, because already I'm seeing here that there's one question. I want to say goodnight to Mario Gill and him, C. Persaud. And Chan Persaud is asking, do you do implants? Well, Chan, last week we covered that topic on implants. And yes, Dr. Pico do implants, any type of implants. And you can WhatsApp on the numbers running at the bottom of the screen, or you can give him a call. So Doc, tell what has been the feedback from the show the programs that we've been having, and is there anything that you want to add to what we've done so far?
Yes, as you say, this evening we will be talking about making like a resume of all the topics that we were touching during these programs that we have been doing for the past few months. So regarding the what you were saying at the beginning, when the oral hygiene start. So I need to remind that as soon the baby born, any baby born, what I am saying to the parents is to explore the baby mouth, not at the very first week or something similar, but after a few weeks, the parents they have to go and explore the baby mouth in order to get to know what is normal in the baby mouth. And
Yes.
if they see anything abnormal, any lump, any um, change of the color, which is not pink, anything that they catch their attention, they have to seek for a professional attention. And as you are repeating all the time, this is not about my office. This is about healthcare
That's right.
in total, in general. So the parents they have to seek attention to any dental office or uh, any service that they are near to them, or any service that they trust, in order to find out what is wrong, um, uh, if that is the case. Okay, so once the parents get to know what is normal in the baby, in the newborn mouth, then by checking frequently, they will get to know if there is any changes in the baby mouth. We need to remember that the first the first tooth or set of teeth are coming out once the baby reaches to 6 months. Usually, nowadays, people will see that maybe some teeth are coming out uh, earlier than 6 months. Teeth can come out into months, or even the baby can born with one tooth out, which is a kind of become like kind of normal these days. And reason why is because the amount of hormones that we are constantly getting in our system because of the meat. Remember that nowadays, unfortunately, to increase the production of meat, the
Growth hormones.
exactly in the chicken, in the cow, and so stuff like that. So because of that, sometimes you will see that the babies are coming with teeth in the mouth, and also the time in which these teeth have to come out is less than 6 months, and some babies are getting the this set of milky tooth earlier than 6 months. Okay, that is the reason why, unfortunately. So once even before these teeth are out of the mouth in the mouth, the mother and the father they have to clean the baby mouth by using a piece of clean cloth, okay, with saline solution to remove this little layer of milk that will be depositing on the tongue of the baby, and also on the cheek and around the gums of the baby, due to the breastfeeding period. So after the mother finishing breastfeeding the baby, they have to clean up this thin layer, because we need to remember as well that in our mouth, as soon the baby is born, bacteria will be growing in the mouth, and this set of bacteria will be changing the population, the type of bacteria, through the whole life of we as a human being. So some bacteria will be growing once the baby is breastfeeding. As soon as you change the diet of the baby, this set of bacteria will change to another type of bacteria. As soon the first tooth come out in the mouth, another set of bacteria will appear, and everything will be like that. As soon the teeth start changing, a set of bacteria will change as well, because depending on the on the environment the bacteria will change into the time and the amount of the population of bacteria in our mouth. So that is why it is important to start cleaning or applying some hygiene measurements even when the baby is not having any tooth in the mouth. Okay, and of course once the set of teeth are coming out, then you have to introduce little by little the toothbrush. Okay, that
Okay.
at the beginning, of course, that once the baby get older, like 6 years old and so, probably, of course, that the baby will not be able, this little child will not be able to brush properly, and you have to introduce the toothbrush at the beginning by using this type of small toothbrushes and toothpaste for different stage age of the babies. So at the beginning will be a little bit difficult because it's difficult to introduce this type of habit, but we need to do it. We need to do it in order to make sure that later on, once this little child becomes more, get more skills, then the child will be able to brush their teeth by uh, by by themselves. Okay, so that is why we need to introduce little by little
Mm-hmm.
the habit of brushing the teeth. Okay, by using special toothbrushes and special toothpaste for that age. Because remember, we need to remember that will be impossible to control, like for example, that the child will not swallow a little of
Yes.
the toothpaste. So that is why the toothpaste for an early stage are not coming with fluoride, because we need to remember that the fluoride is a toxic element once you are swallowing the fluoride for a long period of time. So at the beginning, we will use a toothpaste for an early stage. Usually this type of toothpaste are coming without fluoride, and then once the child is more accustomed and the child get to know that cannot swallow the toothpaste, have to spit it out. So then we will introduce a toothpaste with fluoride.
All right.
Usually this type of toothpaste are coming with the age
Mhm.
on the box, like toothpaste for the first months, then toothpaste for the first year and so on.
Um, Interestingly enough, when you spoke about growth hormones,
Hmm.
it made me start thinking about something, because let's say, the growth hormone, the effect of the growth hormone is because, well, it's not because the child is eating chicken or beef at that early stage, but it's because the mother
Hmm.
would be consuming products that may have growth hormones in it,
Hmm.
and because she's consuming that, that is then transferred to the milk, the breast milk,
Hmm.
and to the child. So also parents should be cognizant of what they're eating. Now, we're not saying that you shouldn't eat chicken or so on, but be careful of what you're eating during that period of breastfeeding, because you can't be eating, I guess, too much of processed food will not be good either, because when you're eating processed food, I mean, and this has nothing to do with dentistry per se, but in pediatric care, because it's making me think that if it can make baby have teeth at an early stage, and the adverse effect will be throughout their bodies.
Hmm.
So perhaps they should be a little careful what they're eating during that period of breastfeeding for the child, especially for the first 6 months too. But then again, in a society like ours, where we have limited um, food resources in terms of what is available and how we can cook with chicken and beef and sausages and so are the readily available things. So, but I guess moderation and lots of vegetables will be fine. I want to say good night to Monica Rupchan, Simone Buders, and Sharmila Gajdar. Hey Sharmila, it's been a while since I haven't seen you around. Marina Samwaru, and so Hemasi Prasad is saying that most parents use honey to clean their baby's mouth. In Guyana, that's true, you know. They use honey and put it in a cloth to clean the baby out. Is that safe, or what do you think about that?
That is really not necessary because mm, I know that the honey has some type of antibiotic effects because of some chemicals that are in there
Mm-hmm.
that are keeping the honey safe to in the once the bees are processing the honey and so, but it's not necessary to apply honey, and even once the tooth are coming out, you cannot use honey because the honey is rich in sugar,
That's right.
so in glucose, so that will be not healthy for the tooth because remember we need to remember that the carbohydrates, and the sugar is a carbohydrate,
Yeah.
is the main um, food for the bacteria that are causing the cavities and also gum disease. So we parents can use honey, like for example, when the baby is getting there is no teeth in the mouth, but the baby is getting fungus infection, for example,
Mm-hmm.
because that antibiotics presented
In the honey?
in the honey that are natural chemicals doesn't mean that there is any antibiotic added in the honey because any human intervention. The honey is coming with some certain kind of chemicals that the bees are keeping in there to make the honey safe, so that the honey will not get bacteria growing in. So that is by nature. Okay, so it's safe to use once the baby gets any type of fungal infection, fungus infection in the mouth. Okay, so we can use honey in that case. Okay, but not once the teeth are out in the mouth because uh, as I say, the sugar present, the glucose are present in the honey will not be healthy to use once the teeth are out.
Marina's Samwaru. Marina is saying, well, because we were talking about what parents should not be eating, and she said they can't eat pepper because pepper will cause thrush in the baby. If the person is eating pepper, then they can that can cause some issues, you know. So if that is that is the case, then then um then it will cause thrush. But again, we're dealing with issues that cause problems with oral hygiene,
Mm-hmm.
and mouth thrush is
The thrush is a common infection in the baby mouth that is coming once, for example, by transfer from the mother
mm,
to the baby, or for example, the case that you say that kissing the baby in the mouth
yes, yes,
can transfer back some kind of bacteria, even fungus in the baby mouth, and some viruses also. I remember that we talked about the herpes. Okay,
herpes, herpes.
the herpes can also transfer
Yeah,
by kissing or by breastfeeding from an infected mother. Okay, so in that case, it's very common to get this type of infection, and in that case, of course, the parents have to seek attention. We need to also remember if there is any other kids around. If you have more than one baby, then you have to separate everything. So you will avoid by doing so the cross infection.
right.
So you cannot use the same spoon to feed the another baby that is in the family, or even a little more grown children, because then you will cause a cross infection, and the other uh, baby or child will get also the infection. And of course, once these type of things happen, the mother and the baby, both of them, they have to go into treatment,
Yeah,
because
yeah,
if you treat the baby and not the mother, then the cross infection will happen again.
yeah. It's like we're doing this first program all over again. But it's good to recap and
Yes, yes,
to share
yes.
this information. Let me ask you about a big thing in Guyana right now is that people are going for braces.
Uh-huh.
And I met somebody the other day who told me that they did the braces and it only cost them $40,000. No, I know that braces is a very expensive treatment. It's over a period of 2 years maybe.
Mm-hmm.
And they said it's a no, this person is good and it only cost them $40,000 one time and they get fixed. So I was taken back. Now I can't divulge information as to what I think it is or what, not what I think it is, what I know it is. But let's talk braces because I remember when we were talking, as we were building up and so on, we did discuss this topic. And as I said, we do this for public information so that people have the right information at hand, that they don't end up in a situation where they do permanent damage instead of permanent fixes. Because a lot of times you think that you're going for a permanent fix, but you end up with a permanent damage because you could end up with deformed teeth and of course you can damage your bone too, right?
Mm-hmm.
Now let's talk braces. Tell me about braces and is it possible to have, in your own opinion and in your capacity and your professional capacity, do you think that it's possible to do a full set of braces treatment one go for, let's put it like this, $200 US?
Mm-hmm. Okay, so well, we change to a next topic about braces.
Yeah.
Braces that people know that about know that feeling identity like braces, but the proper name is orthodontics.
Right.
Orthodontics is
Yeah.
the science that is taking care the teeth that are not in a core aligned.
Yeah, that's
So
right.
the
Yeah.
function of the orthodontist is to align the teeth in a proper way that will reestablish the occlusion, which is the relation of the lower and the upper teeth in a proper way. And by doing so, the patient will get back an aesthetic appearance and also will reestablish the function of a normal human teeth aligned. I meant to say. So the braces is a very complex specialty because um, the person doing braces, meaning the doctor, has to have uh, preparation doing this type of field. So it's not anybody can go and put on braces because there is a science behind that. It's not just to put the brackets, which is the individual uh, um, little. The brackets is the metal or
That's
or the
bracing and
plastic that is over the tooth and will be will be helping by putting over later some wires with different diameters, and those wires and some ligatures and the bracket will start moving the tooth. I have to say that each bracket has an information in the structure of where to, how to move the tooth, how to turn the tooth, and so. So the person doing so has to have preparation. And it's nothing that you can go and read about. You have to study to become an orthodontist, which is an specialty in dentistry. So it's not what I want to say with this is the braces treatment is expensive because of the time and the resources that the dentist has to use in a patient to perform a treatment and to uh, align the teeth. Okay, so this type of this type of treatment that people say, okay, we will start with spending 40,000 and the total treatment will cost 100,000 and so on, and we will do it fast. This is there is a lot of controversy about fast braces, for example. That is another thing that is in the market right now that people claim, or some doctors claim that they can do treatments in less than a year, in 6 months, three months. They can move the teeth so fast that you don't have to spend 1 or 2 years with braces. They call that fast braces, and there is a lot of controversy about that. So, what I want to say to the public is, once you're going to a place that is offering braces at so low cost, you have to inquire the dentist about, okay, tell me about how this treatment will work. Show me your certification. The certification has to say orthodontics. If the doctor is just a dentist, which is doing braces, you have to think about it before going into that. That is the reality. And the Guyana Dental Association released some kind of communication about some dentists doing braces without being certified to do so. So that is a problem in Guyana. Dentists doing braces without being certified to do it. And braces, the braces treatment that is performed without the science behind can mess your teeth, can mess the bone that is holding the teeth, can mess the gum, and the patient can end up developing a periodontitis and losing the teeth later. Or simply the treatment will not work, and the patient will spend a long period of time wearing braces for nothing. So what I am saying to the Guyanese public, that they have to be very careful once it's coming about receive braces in places that are not certified to do so.
Okay, because my thinking is that it's fast braces, yes, but is it also like, look, in general terms in Guyana, I hear a lot of people come and they say, oh, I can do this, I can do that for you quickly, and then they do it, and then it fall apart. We have situations where, and I will juxtapose to say that some people are telling you, oh, I can build your house for you, and I can do it in a short time. But concrete needs 21 days to cure. And they come and they put this thing up. I know somebody who built an extension to their house. They had a wedding coming up or something like that. They built an extension to their house. They didn't leave the concrete to cure. Moved the suspension and everything. The entire room came falling down. There are people also who would say, I can do this, I can do that for you, and then they do a job and it's not well done enough. You end up spending more money. You end up having problems. You end up risking your life because you put yourself in danger. So while it might be fast, whatever they're doing, when you say there's something called fast braces, it's fast money for people. And when they collect your money, they really don't care what happens to you after that. What is the long-term damage that has been caused? And that is, are there regulations to look at these things? Are there are you aware of their regulations that if in place for these things?
Yes, we have the Guyana Dental Council that they are looking after any issue that our Guyanese population is having with any dental office or service. So any problem that our Guyanese population has regarding this type of issue, they can address the complaint to the Guyana Dental Association with the name and location of the doctor, and they will take care of that.
Okay.
But what I am saying to our Guyanese population, be careful where you are going. Ask for certifications, and then ask plenty questions to the doctor. Tell me about how is the treatment plan, which are my possibilities to get this done in a fast way. So you have to ask questions. Show me cases. Show me pictures. Something very funny is also that for you to go into braces, the patient has to submit some tests like cephalogram and panoramic X-ray. And some of the doctors doing any type of treatment without requesting this, that is a bad sign. Because for you to go into braces, you have to ask to the patient, give me, we need to get a cephalogram, which is an X-ray of the skull, sideway, and a panoramic X-ray, which is a whole picture of the mouth from left to right to see the disposition of all the teeth. By using this type of X-ray, the doctor will see if there is any impacted tooth, the position of the wisdom teeth, and so. And also, the doctor has to take impression to get study models for the doctor to do measurement on the study on the models. So, if this doctor is not requesting from you all the things, then this doctor is lost. This doctor is not don't have any idea of what is doing. So, to all the Guyanese, please be careful where you are going to do your braces.
We have a problem in this country with bad driving and accidents and minibus. You see this out very often. Minibus get in an accident. And again, I'm using these scenarios because I want people to understand how serious this thing is. You're in a minibus, they're traveling at a rate of death. And everybody's sitting in there. They don't want to talk to the doctor, the driver, sorry, or the conductor. Or they don't want to say, you know what, you guys are driving too fast, put me off. Let me get off here. Unfortunately, sometime until it's too late. And I'm using this scenario to say that when you are doing these sort of treatment, like braces and so on, you have to put yourself in a position to be safe, to be able to say to them, you know, if you see red flags, say, you know what, stop. Let me consult with somebody first, because I don't think this is a possibility at this time. I don't think that this don't seem right to me, because you can do something that will ultimately be that you can do permanent damage. Now, I know that we kind of jumped off there to go to braces, but it's a sore topic. Some people has asked me about this, and this fly by night braces thing that's happening overnight. Everybody believes, oh, we can just go put in braces. Where's the brace? We were playing cricket down in where I used to play with my guys out there, Ryan and Raphael. Them, and so you think when you came play cricket with us there, and somebody came by there one day and asked him, they got to play somewhere. I'm doing braces. Braces? There's a little garage like this man doing his braces from, and I don't think he's there anymore. And
yes, that is another thing. You have to go into a place that is an official dental office, because you cannot go into a place that is looking like this person put on a dental chair yesterday. Because the braces treatment is something that will take time. You have to build up a rapport with your dentist, because that will be your dentist doing your braces treatment for a long time, because it's not a treatment that will be done in 3 months or 6 months. It's a long time treatment. So
right.
you have to have communication with your dentist. You have to go to your dentist monthly for a checkup and activation of the appliances and so. So it's nothing that if you reach to a place that is looking like they will move the very next day, why you will do braces there? If you have to know that the braces treatment will take time. So you will be visiting this doctor, and if this doctor decides to move to a next location, you have to know where your doctor is to continue the treatment.
But that's always the problem. Always the problem. When people, you see, a lot of times, it's cost. It's cost, right? So they go to a proper place, and then they realize that this braces is it's going to take 2 years. It's going to be a couple of $100,000, perhaps $500,000 or more to get this thing done. And then they hear that somebody is doing this thing for $20,000. They said, man, and I be going and pay $500,000 and getting over 20,000. I go and then do it. So a lot of times what happens is that because of the cost factor, people run to it. But in Guyana, we got a saying, and I don't know if you ever heard this before, nothing go don't be cheap, you know.
Mm-hmm.
Nothing don't be cheap. Perhaps there are some things you might get cheap that you get it on sale or that kind of thing.
Mm-hmm.
But it's impossible for the proper hospitals and high end. Well, I wouldn't want to say high end. Certified dental offices to be doing something for $500,000, and you getting this thing for $20,000. That should be a red flag right away.
Exactly.
It's like if you go to the market to buy some kind of food, this food selling for $1,200 all the time, and all of a sudden these people say, man, the food up on sale for $400. I can tell you right away something wrong with the food.
Mm-hmm.
Something wrong with the food spoiled, or it got something in there that means supposed to be. I wouldn't buy it because I'm putting that into my stomach. I might get food poisoning. I might die. So I'm cognizant of the fact that this is a problem. There's a problem right there, and it's the same approach people have to take towards dentistry. You have to understand that if you and I'm just raising this topic, Pico, because we're all about educating people,
Mm-hmm.
and we're not saying that look, you want braces and so on. We're not saying that, oh, you got to raise a lot of money to get this done or whatever the case may be. But at the end of the day, try and do the right thing. Because, okay, let me ask you this. What are some of the permanent damages that can happen to a person if they don't do the right thing?
Well, can you imagine that you can lose a set of teeth by applying a lot of force? The braces treatment is something that you have to apply the forces over the teeth in a slow way. So, because how is this working is where the the bracket is the wire is pulling the bracket, which is coming with some information about the right angle and so where the pulling force is in that area, the bone will start um, getting loose, and in the other side, that is the other side of the tension, the bone is depositing. So that will end up by moving the tooth. So if you do that force and there is a lot of technical things here that I will not explain that because it's too difficult.
Yes, yes.
But by doing that movement in in an improper way, then at the end of the day, this tooth will get loose and can fall. Not right away, but that will take time. So in the period of time that this doctor is doing something wrong, then at the end of the day, once the braces are the doctor is ready to remove these braces and so you can find that the gum is inflamed, the bone level change, and the patient can end up losing the tooth, or even the pulp inside can die because the extremely force that this doctor was applying in a way that was improper because the doctor didn't make a plan.
It has to be gradual.
Exactly. Okay? That can kill the pulp, and the patient will end up doing a root canal, not only in one tooth, but in several teeth. So at the end of the day, you will end up paying for a little bit amount for braces, but then you will pay more to get replacement of these teeth, to get a root canal, to get a build up and a crown for all that thing. So you have to be careful once it's about braces and so many other things, but about braces particular because you asked me about that. You have to be careful. You have to ask questions to your doctor. As I say again, show me your certification that say that you are an orthodontist.
Orthodontist, yes.
Orthodontist is the specialty
Yeah.
that is in charge to do braces treatment. Any other doctor without that certification is just a doctor that spent, I don't know, went into a course, and so the orthodontist is a specialty. You spend 3 years or even more studying to do this type of perform this type of treatment.
Also, if you were to, and I think this is in general, if you were to operate a dental clinic in Guyana, you must have a certificate from the Dental Council in Guyana.
Mhm.
right? So that is another thing, because if you go to somebody, they might have the certificate because they did it. They would have done it somewhere else. They would have done it in some other place. They would have done this thing. They're here in Guyana. They set up shop quickly, but they don't have the dental council certificate. Then they are not certified to operate in Guyana,
Mhm.
because I believe that the dental council will have to take you through a series of questions and tests and check your location, a whole lot of stuff, in order for them to give you a permit to operate. And I don't think the dental council will give. I don't know, but I don't think the dental council will give people um, who are not certified, qualified, or have the right place to operate a dental clinic. What we're gonna do, Pico, we're gonna invite someone from the. We're gonna reach out to the dental council one day. We're gonna invite somebody to come on the show, because you've been doing this for a while now, and we want to hear the opinion from other people also. So we're gonna invite people to come into the studio and have a chat with us too. Um, so we've spoken a lot about braces there, and I really want to get that out, because it does not only apply to braces, because it applies to general dentistry, implants, crowns, even extractions. So when I was small, I used to hear my grandparents used to call, they say quack dentist, and I didn't know what I said quack dentist. I said it's small looking after duck, because me not understand the going on, right? But quack dentist was the thing. Grew up to understand that there are people who are posing as dentists. Them man used to hear what they used to do. They went, some of them went, that was in the 70s and 80s, Some of them went to the dental school. After 2 months, they get knocked out, but they go and buy the equipment and they're pulling out people's teeth.
Mhm.
I remember a guy in Essequibo, he went to the quack dentist to pull out the teeth, and the man eye for all body. I kid you not. That's all I put it there. This man, the what you call it, it's lidocaine?
No, that depends. Yes.
The lidocaine. But back then we used to say cocaine.
Mhm.
Nobody know what is like. You know what lidocaine. Everybody said cocaine. When this man inject this guy, he took out the tooth. But I don't know if he put an overdose or he put expiting. I don't know what he put in this man's face. The guy, the eye, I think was the left eye, pop out, fall out the socket. And that's possible, right?
Well,
You know why?
why?
Because the nerves in the whole area there were so, it
Uh-huh.
damaged the nerves completely through the band. It was in the newspapers.
Mhm.
It wasn't in the newspapers. The man, I don't know who inject this guy with.
Yeah, you have to be careful.
Right? So what happened is that he was all the nerves on this. So the guy, I think he said he couldn't feel for days and all kind of thing. Days and days he couldn't feel on it. And then this thing started getting loose and then the eyes started popping out. I
Mhm.
don't know. They probably did some kind of. When does that pop out? It then fall out. But it was coming loose out of the socket,
Oh,
right?
okay, okay, okay.
Oh, you thought it fall
Yeah,
out?
yeah, yeah, yeah.
No, no.
You was too graphic.
So no, but you gotta let people know the seriousness of the situation, how it can happen. So I don't know if he had medical intervention to help him or whatever the case may be, but that's permanent damage he would have had there, because whatever happened. So it applies to general dentistry. That when you're going to get stuff started, don't make sure, as we say this on this program all the time, we're not saying that people must go to innovative dentistry to get stuff done. Only there are a number of great places across this country. Whichever one is in your area, you go. But just be careful that when you're having these these stuff done, you have to ensure that the people are qualified and certified to do this. So here we got about 12 minutes to go in the program, and we took up a lot of time talking about that, but it's something I had to get over because it's an issue, and we have to deal with certain issues. Is what we were supposed to recap tonight.
Mhm.
Um, and we did deal with braces or some time back, but these are things that we're going to be talking about from some time. What is it that you want to talk about now, about that you would like to recap on right now too?
Yes, as I was saying at the beginning, we were talking about the horror hygiene and so.
Mm.
Then we will need to go back a little bit about speak about cavities, dental cavities, and so about how to prevent the cavities first. That is why we had a program about in which we talk about the how to pick up, how to choose the correct toothpaste and toothbrushes for our cases, we need to remember that we can go and we speak about Colgate products because it's the type of brand that is
Readily available.
available in any supermarket, and everybody knows about that. And even you told me that people, when they are speaking about toothpaste in Guyana, they say, "Bring me a Colgate."
Yeah. Everything, every toothpaste is Colgate in it.
So in that case, we have a program that we spoke about and we show Colgate products.
Yes.
Okay, so you have to go into the market, and depending of your needs, you will choose the right toothpaste for you. If you have sensitive teeth, some people, you know that even when they are talking, they say that the air that is passing through is shocking when they drink room temperature water and cold water the most. They feel that it's shocking sensation, and they already went to the dentist and they don't have no cavities, but the gums are receding. So you have to choose the toothpaste that is for sensitive teeth. That I need to remember to our viewers that you can go on the box and read that is coming with certain type of minerals that will be taking care of that situation. Okay, so if you have, like for example, problem with bad breath, then you will choose this type of toothpaste for to keep your
Mouth fresh.
mouth fresh. Okay, like Colgate Fresh and so on. And if you need to keep your teeth white, then you will choose a toothpaste for with a whitening action that will not change drastically the color of your teeth, but will keep the teeth fairly white. And if you receive a whitening treatment, a professional whitening treatment, then you have to go into this type of toothpaste for a little while. You cannot overuse this type of toothpaste because then your teeth will become sensitive because of the action of this, the abrasive action of this whitening toothpaste. And that Colgate offer, like for example, the Colgate Opti White with charcoal. Okay, and we need to remember also that we need to choose the type of toothbrush that is for us. Some people don't like the very hard toothbrushes; they prefer to use soft. You have to choose a toothbrush with a small head, because on a small head, a toothbrush with a small head will reach into each corner of your mouth. If you choose a toothbrush with a big head, then you will not be able to brush the back of your mouth. Okay, so you have to make that choice. Also, regarding the quality or the hardness of the bristles, if you are suffering periodontal disease or gum disease, you need to choose a soft bristle toothbrush. And if you can resist, like if you like to feel that you are brushing harder, then you will choose a toothbrush with hard bristles. That is about that topic. Then, how to prevent more about cavities, we need to remember about the changes in our diet. Something very important. Remember that I say one time that I spoke about the roti and so on. Remember that?
Yeah, I was quite mad with you for that.
So we need to do changes, like for example, if we like a lot of too much the carbohydrates, apart that we need to know that that type of diet is not a good diet to follow because of all the problems with obesity and so that will bring to us. Also, the carbohydrates are the main food for the bacteria in our mouth that will be causing later on dental cavities and periodontal disease. So if you really like that and you cannot avoid that, then you have to know that you have to be more cleaning or brushing your teeth frequently to remove that dental plaque that will grow over the teeth once we eat, but also drink, like soft drinks and so, like, you know, all this type of Coca-Cola and so on.
Lots of sugar.
And that is a lot of sugar in the water. So you have to avoid that, and if you cannot avoid it because you like it too much, then you have to brush very frequently and do it in the right way. Okay. So the next topic that we treat also is about sealants. Sealants are a treatment that once the tooth has a deep fissure, which is an area mostly for molars and premolars, is an area in which a cavity can grow because of the deepness of that area. Then we need to apply a sealant to prevent the development of any cavity in there. And once the cavity is already developed, we need to seek for attention before this cavity grow more and reach near to the pulp. That if that is the case, then the pain will be more, and the tooth will end up getting a root canal or doing an extraction if the patient don't want to go and spend in a root canal. So yeah, I'm just speaking in general about what we were talking about for the past few months.
Yeah, and I remember when you know we were looking at we were talking about cavities, and we did reach the point where we say there are some cavities and they get so extensive that if you can't fix those cavities, have them filled, then you have to go to root canal. And then, you know, there were other things where you say that you have to perhaps you can do crowns and
if the cavity didn't reach to the pulp, but however damage too much to the structure, that the filling will not stay long time, because sometimes patients are receiving fillings over teeth that are too damaged with because of cavities. Never mind that the tooth is not the level of damage is not enough that the tooth will need a root canal. However, the damage of the crown will make this tooth not retentive enough to receive a filling, and then the patient will need to receive a crown. Okay, which is an expensive treatment depending on the type of crown that you will receive. We need to remember in this point that you can receive, for example, a composite crown, an acrylic crown, a ceramic crown, a zirconia crown, a Bruxelles crown, an IMAX crown, and depending of the one that you will able to receive, depending on your budget, is the amount of money that will spend. It's not the same. It's not the same price for an acrylic crown than an IMAX or a zirconia crown, which is quite more expensive. So, in order to avoid all the things, everything that you have to do is to prevent. To prevent by practicing good oral hygiene, a good diet, and so on.
Yeah. I want to say good night to Oma Sirinat, Rhonda Spencer, Tom. She's been joining us every so often. Faniza Hanef. She says, good night, my kid's favorite dentist, Dr. Pico, the best. And of course, C. Persaud is having a laugh. I think she's having a laugh when I spoke about the about that quack dentist and I nearly fall out. No, you know, as we do this program, sometimes you will find that I veer off a little bit sometimes into a little bit of Creolese, you know. But we are Creolese speaking country, and I believe that sometimes in getting the message over there, we do it in what we're proud of, which is our language and our dialect. So that is why sometimes you'll find that I go off a little Creolese and that kind of thing, and it's, you know, to keep the program alive too. And of course, there are times when I want to get it over the way we say it and the way we talk out there, you know. And we are a unique country. We're an amazing country. It's a melting pot in this country, and we're getting larger. We're getting bigger. There's so much development happening across this country. It's an amazing time to be alive and to be Guyanese, and it's an amazing time for you to be Guyanese too, and being here. So as we wind down to program time, Dr. Pico, it really has been an amazing few months that we've been having this show, and we touched on a few topics tonight. I know we took up a little time with braces, but I really wanted to get that over because
we will prepare a program especially about braces.
Yeah, because
especially about braces because it's an interesting topic, and it's a topic that people don't really care too much about it. Once it's about to make a show, choose a proper dentist to do braces.
Yeah.
So we will speak about that.
Yeah, but I'm just
field.
worried, and the reason I brought it up, man, because I'm worried about people going and get stuff done, and then imagine you going to fix your teeth, that they're little, the place, and in 3 to 6 months, you lose them all. You end up with dentures, false teeth, and you actually going to fix your teeth at an early age, and because it was not done properly, you end up with dentures. That can't work. Mm-hmm. And people have to be informed and educated about the do's and don'ts in these areas. Mm-hmm. And that is why, I brought that topic up because someone did ask me about it. And
we'll prepare a program about that.
Innovative dental care. Are you doing braces?
Yes, but I have a doctor doing braces. If any of my patients, they see me doing braces, run out of the place. Yeah. Because I am not specialized to do braces.
That's right. So you get somebody who's specialized in that area to do
that area, yes, exactly.
Great. Dr. Pico, is there anything you want to add to tonight's program as we close off tonight?
Just to remember to our viewers to practice good oral hygiene habits and seek for dental attention at least twice a year. And if you notice that your gums are bleeding or you are having any problem, just seek for dental attention. Okay?
Brilliant. Yeah. So, guys, thanks for joining us tonight. As usual, it's been a pleasure. We've had a fantastic program tonight where we did some recap and we touched on some sore points that needs to be dealt with, because we don't want people out there to be going to get treatment and it's not the right treatment and it can cause long-term damage for you. And as we said just now, you may go to get your teeth fixed and you may have it permanently damaged, or in cases with the baby and so on, we talk about the honey and when is the best time to do that. So next week we'll be here again. We're going to be doing this again next week, Wednesday at 6:30. And again, this program is coming to you compliments of Innovative Dental Care, and they are located on the railway embankment, 3 buildings off UG Road, if you're going in the direction of Dentistry. It's a 3-story gray building, and there's a huge sign out there. The numbers are running at the bottom of the screen. You can call and book an appointment, or you can call and talk to Dr. Pico about what your issues are, and he will tell you what's next to do. So, again, thanks for joining us. We're coming to you live from TBN Studios right here in Queenstown, Georgetown. And as we always say, look out for those who are not looking out for you. Drive safe and ciao for now.